Hey, it's Jessica DaMassa with WTF Health. Joining me right now, I have Stephany Verstraete. She is the Chief Engagement Officer at Teladoc. So it's great to have you.
Thanks very much for having me, Jess.
All right, so this is so cool. So Stephany, you came out of Match.com and now you're working at Teladoc. I think that this is hilarious. So can you, because I mean, part of me kind of feels like, I don't know, what does a dating app have in common with telehealth, right? But apparently a lot more than first might meet the eye. So tell me how this happened, this career change.
I'm kind of surprised I actually got the job because in my first meeting with the Teladoc Health team, I explained to them, it was perfectly clear to me. The road to mainstream adoption for telehealth was going to be exactly like it was for online dating. And I think all kidding aside, we really are seeing that. And we're seeing it both right, I look back at the length of time it took for Match.com, for example, to reach its first million visits, right? Same trajectory. We are on path to do 10 million visits, right? So it's one of those things where that curve is the same, and I think it really comes down to trust, right? The trust of data. At the time, what we found was people were really sensitive. We were holding their hopes and dreams.
Right.
It was the data that we had. They were so much less concerned about their credit card data than they were about that. And I think that today, that's how people feel about their healthcare data. It is that personal and that private for them.
Well, yeah, you're holding their health instead of their hopes and dreams, right? I mean, in a lot of cases, they're intertwined. So what are some of the things that I guess you've brought from your Match.com days into the way that Teladoc is trying to engage with, different patient populations? Like, what are some of the things that you have borrowed in order to engage?
Yeah, we spent a lot of time thinking about how to not drive awareness, right? Because really from an adoption perspective and awareness, we're really coming up the curve nicely there. I think it is about how do we change an ingrained behavior? How do we remind someone? My first week of working at Teladoc Health, I loaded up all my kids into the car because one was sick. I think I threw the dog in there, got to the parking lot of the emergency room and literally had a Teladoc Health visit right there because I had forgotten. And that's really the ingrained behavior that we are working on. And we see, right, flu season's upon us right now. It's the perfect time where our core audience of moms and young kids, that's where we really see kind of the greatest amount of adoption happening. But then when we look younger, we look at the millennials, the mental health, that is their first entry point for getting care. And the opposite end of the spectrum, when we look at consumers that are sort of facing more complex conditions, the expert medical services. So I think that's how we'll see the whole adoption curve rise, is by having multiple services. I genuinely think in a cluttered sea on the phone, right, a point solution's never going to win.
No, and I think that we're seeing a lot of that, and I think that, even to the point where, you're seeing big companies like Teladoc Health buy other companies that have a different kind of solution or a different kind of access to a market that they don't necessarily have. And I think I've been hearing anecdotally from a lot of investors that they're all predicting that, these companies that the one-trick pony is basically dead, and that you're going to have these companies that can do multiple different things and do them all really well for the same reason.
Well, we see that, more than 40% of our members have more than one service now, and those people have 4 times the utilization than someone who just has a single service. Wow. Right, and we only continue to see that grow.
So you had mentioned mental health as one of the areas that's engaging millennials. What else is kind of hot in terms of the way that people are integrating with Teladoc and going digital first? Are there any other things anecdotally that you could share as far as what's bringing people to a virtual visit first instead of to the doctor's office?
I think that it's truly key to be there in their moment of need, right? So in some cases that may be us making sure that if they go online, if they go to social media or search, that we're there to remind them that they have the service. And then the other end of the spectrum is working with our clients and really knowing we see the clients that integrate into their experiences, especially with the health plans, where they're integrating into their experience. That's one starting place. We just have to be everywhere that they are.
I was going to ask you for some tips, maybe for anybody else who may have a job that is engagement focused on a patient engagement or health consumer engagement kind of role. What would your advice be for them in terms of trying to make this, be where consumers are, but also simple? Especially when it comes to healthcare, it's so complicated, and a lot of times decisions are made based on what your health plan will cover. So, would you have any tips, even just generally speaking, about the best way to engage consumers, no matter what kind of digital health solution that they may be interacting with?
I think what we're seeing, you hit the nail on the head in terms of you have to make it easy. We talk about having to reduce the friction from thinking about it to getting the care, and that may be removing price barriers. Mm-hmm. So we see, those for whom it's the most affordable, that's where we see the highest utilization. And just remember that people are making the same decisions today increasingly when it comes to their health care and how they're going to access it as they do any other, the other decisions that they're making in their life, whether that is travel or financial decisions.
Do you think the whole industry is going to be elevated by the fact that these big tech companies are entering in this space that are so focused on like UX and consumer engagement? I mean, we're seeing, so much movement by Apple in particular and Amazon and Google. Do you think that the whole industry is going to be elevated? Like everybody's going to have to really step up their game in terms of engagement?
I do, and I actually just think that they're going to. You think about they are the definition in many cases of where people are. And I think that we think about them very much as great partners for helping to do that behavior change up front, but never forgetting that quality of care and that trust is really, really where the decision will be made for repeat.
If you were to say from the trust aspect, because I do think that is so important, do you find that it is there any one thing? Is it really about the health data for people, do you think? Or do you think that it's just one of those, like you had said, like, I've never done it before, and so it's not part of my behavior. It's more that.
I think it's the care experience, right? And it is, that's where I would say it still comes back to, it's healthcare.
Yeah.
And the experience that you have in that moment with the doctor and how you feel about that is really what will define whether you are excited to come back.
I mean, I've done that myself. When I did my first virtual care visit, my first virtual care visit, I could not believe how easy and great it was. And I was like, why am I not doing this all of the time? Skipped all of the bad things about going to the doctor that I hated, especially the waiting room, which grosses me out. I'm not going to lie. Right? That is a terrible consumer engagement experience, is it not?
It is, absolutely.
It is.
Right after the robe.
The hospital robe, that's pretty bad too. Yeah. All right, so great things happening at Teladoc Health. What's next for you guys in terms of strategy as far as new customer acquisition? I mean, you guys are growing so fast these days.
I think it really is about helping people think about virtual care as the front door to how they access healthcare. And not just for one specific need, but really for their full healthcare needs. And that's something that we're spending a lot of time from an engagement and experience perspective.
Stephany, it's so insightful to hear your point of view on this because I don't ever really get to talk to a lot of customer engagement people. And so it's refreshing. Thank you so much for stopping by. And I love I love your Match.com history. I'm almost like one of those, they always say those dating apps, our goal is to get you off of the app, which really is the same thing for Teladoc Health. You want to get people off of the health and exactly. I love it. We're just going to find more and more reasons why this is in like close alignment. I love it. Thank you so much for stopping by. I'm Jessica DaMassa with WTF Health. Thank you for joining us.